Bleeding in between periods. Bleeding in between periods simply means having seeing your period again, or seeing blood when you're done seeing your period. Now, seeing your period cycle usually lasts, some people have their period cycle as from 21 days to 35 days, okay, and your period lasts, the normal period usually lasts from 3 days to 7 days, okay. Anything less than 3 days is abnormal, anything less than 7 days is abnormal. More than 7 days is abnormal. So now if let's say you've had your period for like 4 days or 5 days or 6 days, and then afterwards, after like 2 weeks or 1 week, you start spotting again, either you are bleeding heavily for 1 week, or you just spotted for 1 day or 3 days or whatever. As long as you're done seeing your period for that month, it is termed as bleeding in between periods. So this a lot of things can cause this, which I'm going to explain to you. Sometimes it's not really is a cause for an alarm, but sometimes it's not. Sometimes I'll tell you the things that causes this. And the one that you should be aware of, that you need to rush and see a doctor immediately, is if you're having bleeding after sex, okay. Maybe after sex you had bleeding, or after sex maybe like a day after sex you have bleeding, or some hours after sex you had bleeding, so you should see a doctor. So let's get to the causes of bleeding in between periods. Number one, hormonal imbalance, or hormonal changes. Okay, some things can change your hormone. When a woman's hormones, estrogen and progesterone, sometimes when they drop, you can bleed in between period until when they normalize. Okay, so hormonal imbalance can cause this. People that have polycystic ovarian syndrome, they notice this a lot. Sometimes you see that you bleed more than required. You bleed more than 7 days, 1 week, somebody is bleeding. Please, if you're noticing this, make sure you see a doctor, a gynecologist per se. Okay. Number two is some hormonal drugs that you take, some contraceptive drugs, hormonal drugs. For instance, postinol 2 that we know, the after pill that we know can make you bleed in between periods. Okay. Also, putting intrauterine device for contraception, IUD for contraception, and putting the ones implant on, the ones they put in the hand, even taking your drugs, those drugs that they give you to take for 3 months. Okay, it can make you, at first when you started, because there's a drop in your levels, it can make you bleed. But however, when you start even if you're on implants, you will bleed sometimes for and then it will bleed for 2 weeks, and then it will normalize. Okay, some people bleed as much as 1 month until it normalizes. Okay, 2 months until it normalizes gradually. Sometimes it's just spotting. Okay, so and again, sometimes those drugs they give you to take for 3 months or 2 months, or your drugs, if you forget to take a pill in a day, you didn't take a pill in a day, there's a drop, you may bleed or spot. Okay, so it is important to note that these are part of causes of bleeding in between periods. Now, the next thing that causes this is infection. Very important. Infection can cause this. Infections like gonorrhea, syphilis, pelvic inflammatory disease. I have videos on these infections and how to treat them. If you have PID and it keeps coming back, locate the video here on how to treat them. Yeast infection can cause this. Okay, vaginal yeast infection can cause this. As small as it is, it can make you bleed in between periods. So treat your yeast infection, see a doctor. I have also video on how to treat yeast infection, drugs to treat yeast infection so they don't come back. Can make you bleed in between periods. Now, the next thing that can cause this is if you're having issues in your cervix. Okay, it can cause this. For instance, you may be having cervical cancer, early stages. It can cause this. So your doctor, you go to the hospital, your doctor checks you vaginally and take sample from your vagina to check what is going on. So you see, a lot of things can cause this. So if you're bleeding in between periods, don't just relax. It may be something fatal, something as cervical cancer. Please go and take your vaccine. If you've not taken vaccine for cervical cancer and you're having sex, you know, men can give, okay, I'll make a video on cervical cancer. Men can give you cervical cancer with the infection that they give, and they may not have it. So I'll make a video on that separately. So go and take your cervical cancer, do the test called pap smear. If it is negative, then they will start giving you vaccine, though it's expensive, but every woman should take it. Okay, so having known about this, the next thing that can cause bleeding in between periods is what is it called again? Painful sex. Maybe when the woman is dry and then the person forces himself on the lady, and you know, there's injury in the vaginal muscles, there's, you know, injury, the woman may bleed. So the next thing that can cause this is early stages of miscarriage. Yeah, you were pregnant and miscarriage is about taking on. Gradually you start spotting, and before you know it, start bleeding. Look at the video on causes of recurrent miscarriages and how to stop this. Okay, the next thing that can cause this is if you have fibroids or polyps. Yeah, fibroids, in fact, is one of the leading causes of this. Yeah, if you have fibroids, it can make you bleeding, but sometimes bleeding is heavy. I will talk about fibroid on our next video too, so please be aware of this. The next thing that can cause bleeding in between period is ectopic pregnancy. Yes, I also have videos on ectopic pregnancy here. Also locate it and watch. Yeah, ectopic pregnancy, when the baby is not growing in the womb, it's growing in any part of the uterus, fallopian tubes and all. It can make you bleed in between periods. Okay, now the next thing that causes this is endometriosis, a condition called endometriosis. Most women have this thing and they are not even aware. Okay, please make sure that if you're having bleeding in between period, don't just wait for anybody to prescribe drugs for you. See a gynecologist. Let them check what is going on. If it's a simple hormonal imbalance, or maybe you took your drugs. Okay, if you are taking hormonal drugs, you can see that this can cause it. So you just take a chill, it will be okay. But if it continues, then you see a doctor. But if everything is okay, you have to see a doctor, because you never can tell if it is cancer, fibroid, endometriosis, polyps, any hormonal imbalance, PCOS. The earlier you know, the better, so that you can get treated and you'll be better. If it's infection, antibiotics will be prescribed for you. And make sure you watch the video on how to treat infections so they don't come back, because this is the mistake we make. Okay, so I hope this video has helped you. Let me know if you have questions. My name is Nurse Merit and I'm a nephrology nurse. Like, share and follow for more. Please make sure you subscribe. Okay.